Hello, this is a presentation about right side heart failure by Denise Davis, registered nurse, student at St. Petersburg College's College of Nursing. This was prepared for NUR 3125, Pathophysiology, September 22nd, 2024. Definition and objectives. Definition: heart failure is defined by Harding as a disease state of the cardiovascular system that makes it difficult for the heart to maintain its normal function. This can lead to decreased oxygen perfusion and eventually the inability of the heart to function. The objective of this presentation is to explore right side heart failure. This includes the impact on Americans, the etiology and risk factors, the pathophysiology, clinical manifestations and complications, treatments, and evidence-based nursing practice. The CDC states that heart failure affected almost 7 million people over the age of 20 in the United States and caused 13.9% of deaths in 2022. It was listed as the cause of death on over 457,000 death certificates. It is estimated that heart failure cost the United States over $30 billion during 2012. This number includes hospitalization, medications, treatment, doctor visits, and time missed from work. Heart failure is more prevalent in the southern and the Midwest states. Etiology and risk factors. Heart failure is caused by a genetic predisposition, a birth defect, or a form of cardiovascular disease. The primary causes of right side heart failure are hypertension and coronary artery disease. These two disorders are modifiable risk factors, as well as diabetes, toxin exposure, tobacco use, diet, and lifestyle. Factors such as advanced age, genetic anomalies, and ethnicity cannot be changed. Heart failure affects African Americans and Hispanic Americans disproportionately at a much higher rate than other ethnicities. Pathophysiology. Right side heart failure is generally a result of left side heart failure. Left side heart failure occurs when the left ventricle cannot effectively pump blood into the lungs. The lungs can become congested for a variety of reasons. Chronic lung diseases and pulmonary hypertension are frequently found to be the causative factor. The lung insult and the inflammation that follows cause the capillary epithelium to loosen and leak. This causes the pressure inside the lungs to increase. The left ventricle must work harder to overcome the pressure inside the lung. Blood begins to pool and back up into the left ventricle. This will cause the myocardium of the left ventricle to either dilate to accommodate the extra fluid or thicken over time as the workload increases. The right ventricle tries to compensate for the lack of blood in systemic circulation. Now the right ventricle begins to fail as it has excessive demands to keep blood circulating. Clinical manifestations and complications. Right side heart failure patients often present with peripheral edema, distended jugular veins, shortness of breath, fatigue, chest discomfort, gastrointestinal distress, liver and spleen enlargement, as well as unexplained weight gain. Diagnosis of heart failure is obtained through a series of serum lab studies and diagnostic testing. The serum lab studies should include an arterial blood gas to assess the oxygen perfusion mismatch, a BNP, and a troponin level to indicate any damage to the myocardium. Lactate level, D dimer, will indicate inflammation. and the renal and hepatic panels will give the provider an idea of how extensive the damage is to the kidneys and liver. Diagnostic testing will include a chest x-ray, EKG, and an echocardiogram. These tests will show any physical alterations of the heart musculature and cardiac conduction. The New York Heart Association is universally regulated as the gold standard for diagnosing, classifying, and treating heart failure. Their standardized indicators distinguish the various stages of heart failure in simple terms. Level 1 is your asymptomatic patient with a normal functional status. Level 2, these patients have mild symptoms with physical activity. They also may show a slight limitation of functional status. Level 3, we see moderate symptoms, less than normal physical activity. They are only comfortable at rest, and there is a major difference in their functional status. Level 4, here we see severe symptoms, which occur when the person is at rest and there is a severe limitation of their functional status. As the disease progresses, worsening signs and symptoms of hypoxia occur, respiratory acidosis and failure, organ dysfunction, and eventually death will, if the heart is not repaired or replaced. Treatments. Two treatments that will positively affect the outcome of right side heart failure are extracorporeal membrane oxygenation, ECMO, and right ventricular assist devices, RVADs. ECMO is used to physically remove carbon dioxide from the blood and impregnate the blood with oxygen as it re-enters the body. ECMO is a temporary fix and is primarily used in the OR or ICU. The RVAD can be surgically implanted inside the upper abdominal area or placed outside of the skin. This device serves as a pump for the patient and decreases the heart's workload. A person can be maintained on a right ventricular assist device for quite some time. It is generally used while the patient is waiting for a heart transplant. Nursing evidence-based practice. Nursing care will focus on the relief of symptoms. Hypoxia can be alleviated by the use of supplemental oxygen. Decreased cardiac output can be corrected by medications that reduce afterload and improve blood circulation. Medications such as loop diuretics, such as Lasix, decrease preload by removing extra fluid. Positive inotropes such as epinephrine and dobutamine will increase myocardial contractility and the heart rate, which encourages systemic circulation. Nitroglycerin, nicardipine, and nitroprusside aid in the reduction of afterload, which will decrease stress on the right ventricle. Some medications will have to be taken long term, while others may only be in use for a short period of time. Overall, the patients must maintain a healthy lifestyle by incorporating a low salt, low fat diet, regular exercise, smoking cessation, and low alcohol consumption to be successful at keeping the right side heart failure from progressing. Thank you.